Good evening, everyone, and welcome to the December 2021 meeting of Community Board 2 Health, Environment, and Social Services Committee. My name is Brandon Smith. I am the chair of the committee. There's some housekeeping announcements that I have to go through at the beginning of the meeting, so please bear with me for 1 second while I roll through them. This meeting is called to order and recording has already begun. This meeting is being recorded for public access and archiving in accordance with the New York State Open Meetings Law. It is the practice of Community Board 2 to conduct remote meetings with all committee members' cameras on. Public members are also encouraged to leave their cameras on, particularly if you are given the floor to speak. All attendees, please keep your microphone muted when you are not speaking. To maintain an appropriate discussion and voting process, I will make it known when and which topics are open for comment by committee members, board members at large, and the general public. If you have questions that fall outside of public comment time, please type your questions in the chat panel and we will address them as time permits. You may also email the district office at any time outside of these meetings. We are committed to providing access for all of our neighbors, regardless of physical ability or limitation. If you require accommodation or assistance for full participation, please contact the district office 72 hours before any public meeting. We ask that those speaking or presenting use plain language, speak at a moderate tone, and frequently ask if you are speaking loud enough. If presenting, read the title of every slide and describe any images on the slides, such as photos, graphs, and charts. Before we officially get started, I'll remind everyone once again that it is the practice of this committee and my expectation of everyone in attendance, regardless of which area you come from, presenter, member of the public, member of the committee, staff, anyone, we should all be treating each other with respect here in this committee. If anyone is not acting with respect to anyone else in the course of this meeting, I am going to ask the board office to remove you from the meeting. There is no tolerance for a lack of respect of this committee. At this point, I'm going to have the other members of the committee introduce themselves. Ms. McKnight, would you like to introduce yourself?
Good evening, everyone. I'm Nicole McKnight, board member and vice chair of HESS.
Thank you. Ms. Thurston.
Hi, I'm Jessica Thurston. I'm the secretary of the committee.
Thank you. Mr. Newmark.
Good evening, everybody. I'm Barry Newmark, and I'm a public member of the committee.
Thank you. Ms. Cumberbatch.
Good evening. My name is Monique Cumberbatch, and I'm a member of the committee.
Thank you. Mr. Varela.
Hi, can you hear me?
We can.
Ms. Alejandro Varela, public member. Hi.
Hi. Ms. Einhorn.
Hey, this is Lindsay Einhorn. I'm a member of the committee and board.
Excellent. I'd like to ask the board, our board representative, Ms. Carol Ann Church, to introduce herself.
Hello, I'm Carol Ann Church, Assistant District Manager.
Thank you. And we are delighted to be joined by some other board members here tonight. I see Ms. Latrell Masso, who's a wonderful member of the community board and a frequent guest and a wonderful invited guest of this committee. And Mr. John Dew, who is just the same, wonderful board member and frequent guest here. Thank you both for coming. We're going to try to keep the meeting moving at a orderly pace that will ensure that we get in and out at a reasonable hour. In that manner, and noting that we have quorum, I'm going to ask for a motion to approve the agenda. Mr. Newmark, do we have a second? Ms. Cumberbatch. Mr. Newmark, just a couple of exceptions I would like to note on tonight's agenda. 142 Smith Street will no longer be attending, so we'd like to take them off. And I'd like to ask that we add the presentation times of 10 minutes for the COVID-19 update, 10 minutes for the health and hospitals, 5 minutes for the 174 liquor license, 5 minutes for the renewals, 5 minutes for the chairperson's report to the existing agenda. Would you accept all of those recommendations?
Yes, I will. Thank you.
Great. And just from committee consensus, if there's anyone who opposes this agenda, could you just speak now so that we can record that? Let a record reflect that everybody's in favor of the agenda. Moving forward on tonight's agenda, we've got approval of the minutes of this November 3rd, 2021. Everyone had an opportunity to review those minutes, and does anyone want to make a motion? Mr. Newmark, are you moving to approve? Yes, he is. Is there a second?
I second.
Second from Ms. Einhorn. Once again, anybody opposes or abstains, please let me know. Speak now. Ms. McKnight abstains, or Ms. McKnight, do you oppose or abstain?
Abstain.
Okay, Ms. McKnight abstains. Anyone else?
I'll abstain as well.
Okay, Ms. Cumberbatch abstains. Anyone else who's a member of the committee? Okay, the rest of us would be voting in favor, so that would be 4 to 0 to 2. I'll accept that as the recommendation for approval of the minutes. Now, next part of our meeting will be a presentation from Mr. Barry Newmark with an update on COVID-19 statistics for the district. Mr. Newmark, if you can try to keep your presentation to around 5 minutes, that would be great. The floor is yours.
Thank you. I will do my best. I wanted to do a few different things tonight. Let me just quickly start with what the big hot news is, which is about the Omicron variant, which has been starting to percolate through the world. And as far as I can recall, as of earlier today, a case was identified in San Francisco. That person's being treated. The person's symptoms are reported to be very, very mild, which is a positive piece of news. And everyone that person had been in contact with was contacted, and those who need to be quarantined for a while are being quarantined. So keep our fingers crossed that possibly this variant won't be deadly in its effect on us. But we will see. Certainly, it will probably start spreading across the country, as most variants have. But we can discuss that after my formal presentation. I also did a couple of different things on the presentation. I looked at the rates in Brooklyn against deaths in New York City and in Brooklyn, and also the case rate. I don't think I'd done that before. So just quickly to give the highlights, the case rate of COVID is lower in our and nearby neighborhoods than Brooklyn and New York City, but it is higher in Williamsburg. In Brooklyn, the case rate is 12.2% in the population. The New York City rate is 12.6%. And Williamsburg was at about 14%. Both sections of Williamsburg that have different zip code areas. They were at 14%. Most of our other areas ranged from 10% to 11%. Fort Greene, Bed-Stuy, and Williamsburg, unfortunately, continue to have lower rates of vaccination than Brooklyn and New York City. Other parts of our area and nearby neighborhoods are doing fine. The low rates are 55% for Fort Greene, Bed-Stuy, and Clinton Hill. I'm sorry, 58%, 60% for both sections of Williamsburg. The positive side is that each of those have gone up from last month. So, little by little, they're inching up. But for your information, the Brooklyn rate is 70% and the New York City rate is 77%. And that's for people who've had at least one vaccination. It's not broken out by 2 vaccinations or booster shots. But while I'm talking about vaccinations, getting back to Omicron, all the scientists, all the medical people who I've heard speak recently are urging and reminding people that the best thing we can do at this time is to get vaccinated, get a booster when we may be eligible for it, because all of that heightens our ability to react against the new variant and keep our response to the illness, should we become ill, as minimal as possible. And that means reducing the possibility of hospitalization as well as reducing the possibility of death. So now that I mentioned death, the death rates per 100,000 thus far are lower in our neighborhoods, every area of our neighborhood, than the rate for Brooklyn and New York City. Just for you to know, in Brooklyn, 417 people out of 100,000 have died. And in New York City, it's 408 people out of New York City. So those are rates that are higher than any of us wish they were. And we hope that things continue to get better. The number of deaths that our communities have experienced in the last month is relatively low compared to other months. You know, some areas went up by a couple deaths, some didn't go up at all. So, you know, that's a positive as well. I will be sending this to the district office. If anybody's interested in seeing the large spreadsheet, they can feel free to reach out to the office to get it. And I just wanted to add that we had discussed adolescents and people of different racial backgrounds in the past in terms of their not being really shown in terms of vaccination rates. And that continues to be the case. I tried to find any stats by age groups. And there's a statement on all the New York City data pages, and I will quote, "Further granularity by age is not reliably available at the zip code level due to CDC data suppression of age-based data for small sample sizes." So that's kind of where we stand at this point. If anyone has any connection to getting more granular data, I think our committee would love to see that. I'd be more than happy to assist you in trying to make that public. And my remarks are concluded for now, Brandon.
Thanks, Barry. I appreciate it. A lot to unpack there. And I think everybody should note that we have been trying to get New York City Department of Health to come back to our committee for an updated presentation with a particularized focus of the impact on communities of color and the areas in our district that are most impacted. Interesting. I saw that they've etched up in 11205 above 50% vaccinations, but still it's behind some of the other areas that we cover. That, and we have an item left on our agenda in the other business section tonight to discuss a potential project that we could engage in to promote health awareness in our community. Any questions for Barry on this topic? Ms. McKnight?
Hi, Barry. I missed the time frame when you were mentioning the number of deaths. Was that for, do you hear me? Because I am using, okay.
Yeah, the number of deaths are the total deaths as of the end of November.
Oh, end of November. Okay.
Yeah, and the and the case rate is also through the end of November that I was.
Thank you.
Any other questions, members of the committee, the board, or the public for Mr. Newmark about his COVID-19 update? Mr. Dew?
Yeah. My one question is, in the community breakdown, is it possible to get a more granular breakdown? For example, block by block, because of Fort Greene community, we'd like to actually know where we should be focusing efforts. That's it.
Very,
Yeah, it's a great request. We've been making that ourselves as a committee. That does not seem to be the ability to get that kind of granular level. And I can certainly tell you block by block will never happen because of confidentiality issues.
thanks, Barry. Mr. Varela, this is the last question for this section.
Barry, can you hear me?
Yeah.
Yes,
I wanted to just confirm that you said that the at least one dose for our district was 70%.
No, what I
No.
said is that at least one dose is 70% for all of Brooklyn.
Because I'm looking, I was looking online and I found that for our zip code alone, our zip code where I am 11205, it's at 58%. And I just,
Right.
I can't, that is so astonishingly low when I consider that the entire country is at 70%. I would think we would bring up that average, not be below it.
Well, some of our other neighborhoods are very high in terms of vaccination rate, but Williamsburg and Bed-Stuy, Fort Greene, and Clinton Hill are three that are really lagging behind. It's interesting that the rate of deaths, at least in Bed-Stuy, Fort Greene, and Clinton Hill, is pretty low, considering that the vaccination rate is so low. The rates of death are much higher in Williamsburg. What that's all about, I have no idea.
yeah, and perhaps this is something we can talk about more if that's an area that maybe we want to target with our project later in the meeting tonight. I want to ask that we move ahead in the agenda to our next topic, which is the presentation from New York City Health and Hospitals, Gotham Health. We have somebody here from Gotham Health.
Good evening, everyone. My name is Shalane Baker. I'm a community liaison for Gotham Health. Thank you guys for allowing myself and my colleague to present at tonight's meeting. As I stated before, I also have Mervyn DaCosta on the phone, my colleague, Director of Patient Relations for Gotham Health Cumberland, who is also transitioning into his new role as Director of Auxiliary Board excuse me, let me get his title correct. Community Advisory Board / Auxiliary Board Manager for Gotham Health Central-wide. He's going to talk more in details about our clinic that's located in your catchment area. He's going to speak about services as well as hours and answer any questions that the board members may have for him tonight. Mervyn, I'm going to pass the floor along to you.
Thank you so much. Can everyone hear me?
Yes.
Okay, great. Let me start by saying that Miss Michelle Clark, our executive administrator, was supposed to be on this call, but unfortunately she had to be pulled to another meeting. And I just put some stuff together to replace her for tonight. So if there's any questions that I cannot answer, I'll be happy to do a follow-up meeting to answer questions that I'm unable to answer for tonight. But thank you so much for taking the time tonight to give me an opportunity to speak about our facility, Gotham Health Cumberland, which is located at 100 North Portland Avenue. We are between Park and Myrtle. We have been here for over 23 years as a facility. Prior to that, we were a full functioning hospital. So here at Gotham Health Cumberland, we have high quality and affordable health care for you and every member of your family. We are located in the heart of Fort Greene, and our goal is to help you live the healthiest life possible and build a healthy community by offering services such as adult medicine, dermatology, women's health, which includes our OBGYN department, childbirth classes. We have diabetes treatment and also diabetic care classes. We have our laboratory and our radiology department, which focuses on mammogram screenings and breast health screenings. We also have our ultrasound department. We also have our dental, which we are in the process of expanding. We have podiatry. We have adult immunization, a nutrition clinic, and we also have a pharmacy on site, which make it easier for our geriatric patients. We also have our specialty surgery, which is on Thursdays only. We also have our mental health and our drug rehab program on site, which is, all this is outpatient. We also have our HIV counseling, and we have our adolescent and children health department, which we have our adolescent partners from the ages of 13 to 21, where they can do their annual checkup, their asthma screenings, their dental clinic, and dermatology care. We also do childhood obesity classes, and we promote lead screenings and treatments for all children over the age of 3. That's one of our passions, is to make sure that all the children in our pediatric department get lead screening and, if necessary, treatment. We do our flu vaccines for all our children. We have a inpatient, on-site WIC program for families who need extra services. We also have family planning. And we also have a confidential HIV and STD for adolescents. And we also have a mental health counseling and support system through our sister facility, which is Woodhull. So if any child that we are not unable to represent here with any mental health needs, we make sure they get a referral either to Kings County or Woodhull, one of our health and hospital facilities. We like to consider ourselves here at Cumberland a one-stop shop service for all your health needs. We also, I would like to piggyback on what Mr. Newkirk was talking about earlier. Due to the new variant, we have noticed a high volume in our vaccine and our booster shots that we do daily. We do close to 150 to 200 vaccines a day, and our booster shots are around the same amount. And we also notice a trend, an uptick in our COVID vaccine testing. We do close to 200 to 300 tests a day. So Cumberland is what we would like to be known as a pillar of our community, which we really would like to make our community a healthier and stronger place where you can come in and get any type of services, and we will not turn anyone away based on their income or their immigration status. And that completes my report for tonight. If there's any questions.
Thank you very much, Mr. DaCosta. That was a fantastic overview that you've provided. It's really great to hear about all the different services that are being provided there, because I think you touched upon a number of things that our committee has been very concerned about, whether it be asthma, prenatal care, diabetes. Those are all different concerns that we've discussed in various meetings of this committee in the past. And we're looking forward to potentially planning a health fair in the next year, and hopefully, that could be part of the that can be part of the effort. We're at the beginning of stages of that, but you might be a potential player of somebody that we could talk to in that regard, I would think. With that regard, we have a few minutes for questions from members of the committee. Members of the committee, questions for Mr. DaCosta? Let's see, Ms. Thurston.
Hi, thanks, Brandon. Thank you for that presentation. It's really helpful to know about your services. I wanted to make sure I understood your last point, Mr. DaCosta, when you said, will you accept all patients regardless of their financial status or immigration status? Like, can someone be totally insured and show up and get help?
Yes, we will.
Okay.
turn anyone away. We have our financial counselors. Based on your income, if you are making some type of income, of course, they're going to do a background check. They're going to check your, if you don't have a social security number, or if you do have a social security, they're going to run your social security number. If they find out that you are working, we call it the sliding fee scale based on your income, and how much you pay. Some people pay as low as $2 per visit or $2 per prescription. If you are an immigrant, which you don't have any income coming in, we definitely will see you, no charge.
Great, thank you.
You're quite welcome. Thank you.
Thanks. I saw a second hand go up, I believe. Ms. McKnight?
Hi, thank you for your presentation. Mr. DaCosta answered one of my questions. My other question, you mentioned about vaccines. Do you accept walk-ins or is it by appointment?
If you are a current patient or if you got your first or second dose with us, you can walk-ins are fine. But if this is your first time at our facility, we strongly suggest that you call ahead. I can give you the appointment center number. Yeah, I can give you the appointment center number and you can schedule an appointment. But if you are a current patient, you can just do a walk-in. And that's including for the booster shot as well.
Thank you.
And I have that 1-800 number if you guys would like it. For the appointment center, it's 1-800-654-0022. Once again, 1-800-654-0022.
Thanks. I put that in the chat for everybody. Any other questions from board members or members of the public for Mr. DaCosta? Mr. Newmark.
Hi, Mr. DaCosta. Thank you again for a really good presentation. I was curious about whether you have any sense of any increase in requests for mental health services from people that you can attribute to the COVID experience and even the long haul COVID experience. And also if you've been seeing any increase on the part of mental health needs for children who are not used to being back at school and having a hard time in adjusting.
Great question. We have seen an uptick in mental health issues for our youth. We have been referring a lot of our adolescent patients, especially high schoolers, to our sister facility, Woodhull, due to mental stress, lack of social interaction over this COVID. Everybody was locked in the house. The rate of abuse have gone up. We have noticed that we've been getting a lot of calls about children and abuse. Those numbers have gone up a little bit, but definitely mental health for our adolescents have been going up. We also have an uptick in our adult population, but we have seen a significant increase in our adolescents.
Thank you.
You're quite welcome.
Mr. Varela?
Yeah, thank you for your presentation. I had a general question about, I mean, this is probably would be anecdotal, but what are you hearing or what is your sense of the most common reasons for people not wanting to get vaccinated, if you've heard of any? And my follow-up to you is, or not follow-up, my other question is around maternal and child health services, if you provide or if you refer out for prenatal and peri and postnatal care.
For post and natal care, we do in-house. Mental health, we refer to our sister facility. For your vaccine question about why people are not getting the vaccine, the most one we hear a lot is that it came too quick. This has been done too quick. It's going to affect something long-term. So everybody's saying that this vaccine was done too quick. So that's what we're getting That's why most people, and some staff are saying the same thing. This has been done too quickly, therefore I'm not going to take it.
Thank you very much.
To Mr. Varela's point, I think he asked also about prenatal care and whether you do that in-house or outsource it. Do you have a response to that? And do you want to go into any detail about prenatal care? Because that's something our committee's been a bit concerned about.
I can get more information, but prenatal care is done in-house.
Gotcha.
Yes.
Thanks.
I can do a follow-up for for your next meeting if necessary.
Well, sure. Or yeah, feel free to provide any information in writing, but to the board office. But I think, we'll be in contact with you and love to have you in future meetings. We just try to keep the agenda pretty
Understand.
close cut because we've had some longer meetings this year. Ms. Church?
Understand.
Hello, yes, I have a couple of questions. One, I'm just tagging off of Mr. Varela with prenatal care. Do you use midwives as well? Do you have a midwife program?
No midwife program.
Okay, but I have a couple of other questions of my own. One is some of the data regarding lead screening in children. Would some of that be available for us to use?
I could definitely get back with you on that. I don't want to say that due to HIPAA violations, I don't know if we can give out that type of information, but I definitely will get back in contact with you on that.
Just looking for numbers like trends over a period of time. And the other thing, two quick questions. Specialty surgeries, what are those?
Outpatient surgeries, such as if they want to just get like a ball removed or something like that. Nothing that's you under sedation for a long period of time.
And I think I had one more. Expanding dental, expanding dental care, your dental program. Now, dental is really expensive for most people. Insurances don't cover it broadly. Even if you have dental insurance, it's still quite costly. So if you could indulge me with just a little information regarding your program.
Okay, what I meant by expanding dental care, we are remodeling to bring in more providers. Dental is under, I don't want to say a different contract from our other departments. Dental, you will have to pay. Our other medicine departments, free of charge. Dental, you will have to pay. It's under a different contract. That's an excellent question. I do apologize about that.
Okay, maybe sometime later we can have some more detail about that program, because I'm really interested in community dental care. That's a question I see popping up a lot in neighborhood chats. Access to dental care.
I'll make a note of that. Thank you so much.
Thank you. I look forward to hearing back about the data.
Yes, ma'am.
We do thank you for that, Mr. DaCosta. Just to Carol Ann's point about the midwives, and we'll look forward to seeing the further information about the prenatal services that you have. I think if we don't have midwives, the open question I would have is for folks who are coming in, getting the prenatal services, who may not be astute or aware of all the intricacies of medicine and who's advocating for them, and really addressing the ability that for them to have autonomy and make informed decisions. How is that decision-making process supported for people who may be younger and needing prenatal services? I think that's a big part of where we're going with the midwives. Ms. Thurston, I saw you had your hand up. Did you want to ask a final question here?
Yes, a very quick one. Thanks. Mr. DaCosta, I have a follow-up about the vaccine, like what Alejandra's question about what excuse or reason people are providing. And one thing we've been wondering about is the issue that are folks coming for their second shot if they're getting the Pfizer or Moderna? Or are any folks saying that they aren't for any reason? I ask because my my theory is that a lot of folks don't know they can take time off work if they have, you know, a reaction to the vaccine. But it's been hard for us to kind of figure that out. So have you seen that, a drop off in second doses, or that reason that folks think they can't get off work?
No, we have
Okay.
everybody who's scheduled for that second dose are coming back, and they're
Okay.
back earlier for the booster, but it's a hard stop, 6 months. You have to come back
Yeah.
6 months, but everybody who took that first dose, unless it's something that happened that they have to take the first dose over, they are coming back for that second dose.
That's great to hear. Thank you.
You're quite welcome.
Thank you, Mr. DaCosta. We're really happy to have had your great presentation, and we'll look forward to working more with you in the future. Appreciate you and your organization reaching out to us, and good luck with everything and the great services you're providing.
Thank you so much for the opportunity. Thank you so much.
Thanks a lot. All right, moving to next on our agenda tonight, we have public comment on items for action. This is an opportunity for the public to comment on items that we're going to vote upon tonight. There happens to be only one item that we're going to vote upon tonight, and I will solicit public comment again after I announce this item, but this is your opportunity now, members of the public, to have comments on our item for voting, 174th Smith Street, the Cream Global Corp. We will have a presentation on them shortly.
Yes.
I'm sorry,
Yes, yeah.
Are you here from 174?
Yes, yeah.
We'll take your presentation in just a second. It's maybe a little confusing, but the point is to try to see if there are any community members who have points that they would like to make about this first.
Okay.
All right. Let the record reflect no one has raised their hand, and we can move along to our liquor license review. As should be a surprise to no one, the next item is 174 Smith Street, Cream Global Corp. Sir, could you please give your full name so that we can record it in the minutes? And
yes.
And who will be presenting this application?
James, last name Wang, W-A-N-G, representative.
I can share my screen, Brandon.
Thank you so much. Now, Mr. Wong, before we get started here, it seems that the contact information is blank. Do you think as a condition of any action that we take now that you can fill out this contact information and send it to the board office?
Yes, definitely I can send over, yes.
Great.
But I cannot send it right now. Okay, so definitely I will after the meeting I will send it over, yes.
Okay, it actually looks like there's part of it that is filled out. It's just that maybe very small print, so my poor eyes have not been able to see it. It looks like this location is called Mad for Chicken.
Yes, right.
And
yes.
we're on Smith Street. What's the cross street?
Oh, okay. So hold on a second.
That's okay. We can come back to that. Do you want to give us a little overview about what your business is about?
Yes, yeah. They will be the restaurant. So this the franchise restaurant. So they already have the one store in Brooklyn in 617 Grand Street, and this the second store in Brooklyn. And for New York City, you almost have the so is a place. So for call the same name, Mad for Chicken. The most parts is in Queens. So the owner to have the business, so is in 7111 18th Avenue in the is like the eating and drink establishment. It's a little difference, but anyway is for the this for eating place. So they do the owner don't have the license yet, but this the first license for the owner. For the liquor license for the owner.
Great. Well, I appreciate that, and I do see your hours here. You're not going to have any outdoor seating? No outdoor seating?
No.
Okay, and you're going to close at midnight, 7 days a week. Is that your proposal?
Yes.
Now, as I recall, this location was previously a place called Pana y Vino, which was another sort of late night bar and restaurant. And I will say the hours are pretty consistent with that. Are there any residents that live above?
For this building, yes. So this total building is for the 3 floors, but right now the upstairs is empty. But is for the residential purpose. Yes.
Okay. Have you spoken with the residents?
I said the upstairs is empty. The whole building is empty.
I'm sorry. Did you say you did speak with them?
Yes. Nobody leave the upstairs. No, is the building is empty.
Oh, the building's empty right now. Okay.
Yes, right. Yes.
Okay, gotcha. All right. And did you post? I didn't see that in the materials, but maybe.
Yes. So you can see the picture. Yes, you can see the post on the window. Yes, on the door.
Oh, I do see. Thank you. That's great. What kind of food will you be offering?
There will be a chicken place, just like the name, made for chicken.
sense.
Chicken place.
When do you plan to open?
I think it will be at least 2 or 3 months. So maybe a little later. Okay, waiting for the liquor license process. Yeah.
Gotcha. Okay. Questions from members of the committee?
I have a question. Do you already have a Brooklyn establishment? I believe I've ordered from you before, so I just wanted to know if you'd already had a presence in Brooklyn.
617 Grand Street.
Yeah.
Any issues at that other location with noise or complaints from neighbors?
No, nothing. It's clear.
That's good. That's good. I see you plan to hire 4 people.
Yes. Yeah.
We had doesn't have a bearing on your application. We had the committee recommend that you try to hire locally because we have
Yes.
a lot of pockets of unemployment in our community, and particularly down near where your location is, there's Wyckoff Gardens, and you could probably find some folks who live down there who wouldn't be such a long commute for them to come over and work at your restaurant. So
Yes. So when we planning to hire somebody, so definitely we will be notified to the board. So if somebody need help, okay. So we're glad to hire the local people. Yes.
great. Any other questions from the committee or members of the board or members of the public for this application? Does anyone wish to make a motion? Ms. Thurston,
I'll move to approve.
we have a second?
Second.
Second, Mr. Varela. Discussion on the motion? All right. Ms. Thurston, how do you vote? Favor. Ms. Cumberbatch, how do you vote?
In favor.
Mr. Varela,
In favor.
Ms. McKnight,
I approve.
Mr. Newmark,
In favor.
Ms. Einhorn,
Approved.
and I vote in favor as well, too. Think I got everybody. Should be unanimous. Mr. Wong, we wish you luck with your new restaurant, and hope you have a happy holiday season.
You too, for the old board member. Yeah, happy holidays. Thank you. Good night.
Thank you, Mr. Wong. Bye-bye. All right, everybody. Next up on our agenda tonight, we've got our renewals. We've got a list of, appears to be 6 of them for tonight's meeting. 1 restaurant wine, 118 Montague entitled Saketumi, 200 Schermerhorn Street, Brooklyn Fair, 919 Fulton Street, Emily's, 76 Henry Street, Kogane Ramen, 1 Front Street, Grimaldi's, and 132 Greene Avenue, Aita. Ms. Church, have we received any comments or feedback at the board office about any of these renewals, expressing any concerns?
Have been no complaints of any of them.
That's great. Any questions, comments, or thoughts on the 6 renewals from the members of the committee or the members of the public who are in attendance? Okay. I make a motion that we approve all of these renewals. Is there a second? Second from Mr. Newmark. Any discussion? Hearing none. I vote in favor. Ms. McKnight, how do you vote?
Yes.
Mr. Newmark? Yes. Ms. Einhorn?
Yes.
Hey, Ms. Thurston?
Yes.
Ms. Cumberbatch?
Yes.
Mr. Varela?
Yes.
I think that's everybody. Everybody, we've approved all of the renewals. Okay, chairperson's report. We made it through a good portion of the meeting so far, and I'm hopeful that you all feel that we're doing a little better with being timely with our meetings. Want to lay out the plans for the next couple of months here and just kind of briefly talk about where we're going so that you have an idea, even if you're not a member of the committee, about the things that we're looking to present up in the future. And we'll have other business and community forum later in the committee meeting where other ideas can be raised and expressed. Coming up in January, I'm hoping that we're finally going to get our New York City Department of Health presentation. Members of the committee were great to circulate a number of questions. I think if you have additional questions about the Omicron variant, perhaps maybe you could circulate them this week, and I'll try to combine them with the other questions that we can send, because I'm sure that that's something that's come up on everybody's mind recently. The idea of getting Department of Health in here is to particularly talk about the impact of the COVID-19 pandemic on people of color, communities of color, and the neighborhoods within our district that are the most impacted. And hopefully it will be a good presentation, and we can get some understanding about what lessons they've learned from this pandemic, and how we can try to get to a point where the next major disaster or issue, that health emergency, happens for our community, that it isn't drastically impacting communities of color in an area in a manner that outpaces the way it impacts other communities. So that's going to be the hope for the next meeting. We've had some scheduling issues trying to get Department of Health on board because they've had some staff turnover, but I'm optimistic that will be coming up soon. Following the Department of Health, I anticipate we're going to get National Grid back here again for a deeper dive on the 2050 agenda. I think what will be really key to that is to sort of dive into what assumptions were relied on in coming up with 2050 as the point. And sort of along the same lines, there was sort of an aspect of that presentation that stressed energy efficiency measures that had to be taken by homeowners and ratepayers in the short term as part of the 2050 plan, with the major infrastructure changes that they were going to take on really taking place between 2035 and 2050. And what really struck me about this was that if we're talking about 29 years from now, how can we really reasonably know exactly how many, or even with any proximity, how many buildings in our community are going to be running on electricity at that point? Hopefully we can aim for a much greater percentage than what was suggested. But that's something that we'll take up at a future meeting. And there were some items that we had requested in as a follow-up to the National Grid presentation in October, which I'm hopeful that they'll provide in writing to the board office in response, particularly around their compliance with the 2020 items that they had said would be done in 2020. Beyond that, I'm open to other ideas that folks on the committee have for meetings that exist, for meetings that we should prioritize that are health, environment, social services related. I think at any point in the year, we should be thinking, we need to adequately cover our bases in terms of environment, healthcare, health disparities, social services, homelessness, all of these different topics. And if you can reach out to myself, the board office, Nicole and Jessica, we're trying to work together to make sure that we come up with good meeting ideas. And particularly climate change is going to remain on the high agenda, and we'll try to have an additional meeting beyond the National Grid meeting that's focused on climate change. But I think given the ideas around timeliness of meetings, we're also trying to make sure that we have, you know, one at most two presentations per meeting so that we don't overload things too much. So if you have a great idea, and we may get a bunch of great ideas, just understand that we're going to try to prioritize it with the different things that we have upcoming and not try to overload any one meeting again. I think that pretty well summarizes what I've got to say for Chairperson's report tonight. We can move on to the next item on our agenda, which is other business. And we have a quick discussion I hope we can have on the district needs statement, which I think would be great if Ms. Church could take the lead on giving us some feedback on the last results. Ms. Church, are you prepared to chat about this? If you are, you're on mute. But now you're with us. Good.
Okay, great. Hello. So we've been reviewing the budget priorities as they were presented, and I was just thinking of how can we make them stronger. And we need to think, what is our request? What are we asking for? Can it be, it has to be specific to funding. And can we be, hate to use specific again about what that request is? Depending on where it falls, you know, then the context which we, not just this committee, but the other committees also provided, helps to frame the request. But we need to focus in on the request itself. What is it we are asking for? Maternal mortality, I'll use that as one example. Our overall ideal is to have those numbers drop, to have it come in line with that for Black women, the same as for other races, as well as, you know, if I just expand it a little bit, the United States has one of the highest maternal mortality rates in the world. Who would have guessed? You know, so community by community, we can change. So what is our request in terms of getting to that point for our numbers? Is it, you know, alternatives to delivery like the midwifery? Because we learned from, I can only remember her first name. She was a professor and her first name was Helena. From her presentation, we learned that having a midwife in the birthing room reduces the mortality outcomes. So how do we phrase such a request to include that? And that's how we have to think about it. We also have to think whether our request is a capital request or an expense request. And when we look at the request itself, if it's an expense request, well, does it require a capital side to make it happen? Or vice versa, if it's a capital. And I'll use an example. Motorized litter patrol for under the BQE. That's been an area of chronic illegal dumping for my entire time at the board. And I want to guess it's probably been that way for at least 30 to 40 years. So we can ask for patrol, but the patrol includes equipment and staffing. So it's a dual request. It's both capital and expense. So I pulled those out for us to really think about it. We had some other, I should have shared it before the meeting. We had some other items that request had both the expense side, and they weren't necessarily our committee related. I'm just using this as examples where request was both capital and expense together. For instance, there was one from transportation that states you want to improve pedestrian safety through realignment of the lights and changing the positioning of lights, and I should have said timing of the lights, to realign the timing of the lights. And it also included installation. If you're including installation, you're going to run into capital expense. And capital expense starts at $35,000 and will last. Oh gosh, I can't remember if it's a year or 5 years now. So these are the things that we really need to think about when we begin writing, when we begin narrowing down our priorities. Another thing that I think we should think about is we all the committees do this, please, this is not just about our committee, is we come up with lots of ideas and submit them. Our committee has the largest portfolio, so we should have the most ideas, but I would like to suggest we think about narrowing the number of items we come up with. So I don't know, for a committee with our size of portfolio, if I had to pull a number out of a hat, 20? Because we come up with more than that, right? And then we begin to look at them, analyze them. Is this something that can be fulfilled through a funding request? How do we phrase it for the most impact? And do we have the context, evidence-based, to present this to someone who's going to think of funding it? It's almost like writing a proposal, right? Each request is a mini funding proposal. And then we begin to work on it. I would like for us, the last 2 years have been crazy, but most of us would remember that we would try to complete this in June. And so we sort of worked on it over the summer, refining it so it was ready for October. This year we ran late with it. Part of it was due to the size of agendas of other committees and all that stuff and our staffing. But, you know, at the end, I just had to plug the items in and couldn't really work a whole lot on the narrative. So at least we got it in. It's not the document I had hoped we would be able to get in, but we did the best we could with what we had. But if we can start from now thinking, what are the things that are important to us? What would we like to see the outcome be? We can actually begin developing our statement meeting by meeting, 15 minutes at a time, so that when, you know, April comes and we begin to take that deeper dive in, we have something to work with. We're not starting from scratch, and we've been thinking about it and we've been collecting information.
Thanks, Ms. Church. Anyone on the committee have thoughts they want to raise about this? Ms. Thurston.
Thanks, Brandon. Thanks, Caroline. I think that specific guidance is really useful because I know sometimes it can feel like we're going blind into this. One thing that I still think would be very helpful is to have a better sense of the response we do or don't, essentially the status of last year's requests as we begin working on next year's. So I never really know, like, did we even get a response from Department of Sanitation or what have you? Like, I think it can be unclear to most board members about what works. And so if there, I don't need to create more work for the office, but I do think it would be really helpful to have kind of an update in a few months about like what was a response or that specific guidance per item, as much as is feasible. So that's just my suggestion. And obviously I'm happy to help work on that. But I do think that that sort of check-in would be really useful.
So So for our February meeting, maybe we can discuss the responses because they do send us the responses somewhere in January. We'll get responses. So then we can look at the responses at the February meeting and begin that analytical thing. And I'll share the document I wrote up with some of the examples.
Oh, that'd be awesome.
Yeah.
And thank you, Taya, for sharing that in the chat. Great.
Cool. Ms. Einhorn.
So I think in a lot of committees where people work on this, there's like one or two people who end up taking the brunt share of the work, but there are so many different categories of need within this committee's scope. I'm wondering if we could define those categories and then each member could take on one and sign up for one and do the research and really think about fundable items. I do think, to Ms. Thurston's point, the responses from last year, because I've been writing this for the Economic Development and Employment Committee for a couple of years now, and I find the responses to be invaluable because it really helps you to factor in what we think of as fundable versus what the city thinks of as fundable. Because I think a lot of times the responses that we get are, this is not a fundable item, or this is outside the scope of our purview type things. And so it helps you zero in on what actually is a fundable item. The one point that from Ms. Thurston that I really want to echo though, is which items do get funded and then actually worked on is not necessarily the same thing. So like there might be something that's funded, but it's a project that is several years in the making and it doesn't move forward. And we don't know that type of status. And so the responses don't capture that. And I think it's a lot of work to put on the board. And I also would like to volunteer to try to help to do some of that tracking. Because I think that that's the piece where we don't know if an item should be carried over year to year and advocated for year to year. Because even if they say, oh, we'll look into this, or we think we should study this further, that's where it becomes an issue.
All right. To the extent it helps with tracking, I got a spreadsheet that has a list of all of our priorities for the committee, so I can share that with anybody. And if somebody can find the response to each of the 20 something items and copy and paste, perhaps that's it makes it a little easier. Mr. Varela?
Yeah, I guess I wanted to speak a little bit to the how do we define priorities and really with public health, how do we prioritize interventions, right? We're different than maybe other committees in that there isn't one specific answer to addressing maternal and child mortality inequities, right? Like if there's a pothole and someone that's a priority to fix potholes, there's one way to do it. I mean, sure, an engineer might say there are 3 different ways to do it, but you know, generally speaking, you fix the pothole. To address the sort of the gap between outcomes, health outcomes, you know, we have to look at tiers, right? So there are the sort of downstream and then the upstream and then the midstream stuff. And I think as a committee, we either need to have some sort of rubric in place for each priority that lends itself to health outcomes, so that if we see that in our district, there are there's a higher rate of maternal mortality, then we need to decide which are the proven interventions for that particular health issue. Those people do that work, so we don't need to do that work. We just then need to decide what we can nominate as our intervention. I'll tell you right now that like we know that based on the stuff that we've looked at in committee and tons of research out there, that the stress of racism is real, it is chronic, it has a huge effect on maternal and child health. And so, you know, addressing racism as an intervention, right, is not really a priority we can put on there. I'd love it if we did, but it's obviously, strikes me as an example of like not a useful way to use a priority. So then we need to look at like whether it's going to be more options for at-home nurses, you know, or if it's going to be targeted income, so that if we see a pocket of extreme poverty, if we show that there's research in Canada that if you give people lump sums, that decreases the stress in their household and therefore reduces the risk of low birth weight and maternal or child mortality, then that's an intervention. And then we need to decide, is that an intervention that HESS in Community Board 2 of New York City is going to propose to the city government? I think it should be, but do you see what I mean? So there are various levels, and I think we just need to, it would be useful if we had a rubric so that every time we approach or we get to this point, we don't sort of say, oh, how do we address this? We decide if we're going to go low, middle, or high. As an example, it doesn't have to be that rubric, but sorry.
That makes sense.
Yeah, I think that's an awesome idea for deciding, especially when we have to decide amongst many. That's an awesome way to decide within our own selves the priorities. What are we going to select? I think all committees tend to have a lot of ideas that bend towards policy. And that's good, but it doesn't belong in our statement. We need something a little more tangible, like policy and legislation. While that may require some sort of funding, it's not the way the statement is meant to work.
Carolyn, or is it about finding a way to fund that hyper locally through a specific program that already exists, or not program, but organization? And say, call it a pilot program or something?
I'm not sure I'm reading you. I got two senses. Is it who's funding, the city or the organization? Because what we're requesting is the city to do the funding.
No, I understand. But to your point that it might sound like legislation or something like that, or that it's a citywide issue, but finding a way to make it hyper local and funding specific programs or organization within the district as pilot program versus recommending an outcome that is citywide versus, that kind of thing.
Yes. You hit the nail on the head with that, Lindsay.
Any other thoughts on the district needs conversation?
It strikes me that based on what Lindsay said, and I completely agree, that's a great point. It seems that as we make these things, like as we're packaging these items, like it's almost like they need to go through a step. I keep saying like, tell my children not to say like, and here I am. Maybe I need to think this through before I offer this.
While we're thinking that through, Alejandro, Ms. Mueller has suggested that the committees review things in January, but our committee tends to meet a little early in the month. Ms. George, do you think we're going to have the responses by when we meet in January?
Very doubtful.
Okay, well, maybe we can do that in early February then.
Okay, I thought of a better way of saying it. Sorry. It's that it seems that in years past, we spent a lot of time up until the last moment working very hard to come up with the list of priorities or concerns, right? And then it's almost as if when the deadline is done, then we scramble to fill in the justifications and the possible interventions to deal with that. So we spend most of our time coming up with a list of concerns. And so maybe we have deadline for concerns, and then we have deadline for the sort of operationalizing that concern. And then we have a deadline for, as Lindsay suggested, and please correct me, that if we're really adamant that we want to address something, but it doesn't sound like it will fit what the district needs statement asks for, then we have a deadline for coming up with that vision for a pilot project or a way to make it fit as an expense or as a capital. But we need those sort of steps, because otherwise anyway, you get what I'm saying.
Ms. Einhorn?
So I just want to recommend one strategy that we're doing in economic development, which is we're doing community forums with organizations and programs where we can discuss fundable programs that would support their current programming or expand current programming. So like we have one meeting with just the bids and one meeting with just the nonprofits. And so maybe the way to translate that for this committee's scope is to look at community health providers like Gotham and get them to come to a roundtable to have a discussion about this.
That's a good idea. I like that thought process. Did I see another hand? Maybe Miss McKnight. Yes, go ahead.
Yeah, so I was just going to say, I like where Alejandro and Lindsay were going with this to really narrow down our ideas. I think it is important to get community or stakeholders input. And as Alejandro mentioned, the concern about we have such a big array of topics that we want to cover, we can narrow it down. So I think we're all just going back to how Carol Ann outlined it to us, but we're just trying to think of the approach. So we don't fall into this again. I think it's important by our next meeting, we kind of give ourselves some real concrete deadlines on what are we going to do and what are the dates we're going to get it done by. And that's all I have to offer.
That's a good point. So maybe that's something we can talk about in between this meeting and the next meeting to try to figure out what are good dates that would be, because it seems to be a common thought that's coming up between different people. All right. Any other questions on the issue of district needs or comments?
Is it too soon to come up with this sort of timeline or idea?
No,
Or no?
No, it's not.
it's not.
So maybe we should just, kind of get a ballpark of what the first deadline is and for what. Because if Lindsay's was just a great idea, these roundtables and stuff, that requires planning and getting folks to come in, no?
That's true.
That's true. But here was my, what I was thinking. Do we want to start where you, what are our areas that we want to focus on and then have them come in? Or do you think it's important to start with the community forum first? Because I know we do have a sense of areas that we have said this is definitely a priority and we do understand as being a need in the community.
Yeah, and perhaps that's something that we can establish at our next meeting. We can try to each come prepared with the items that we feel are the priorities, be prepared to sort of discuss them as on an agenda item related to district needs. And perhaps we can come up with a list of what we feel are the priorities at that point. And then we can move from there into sort of coming up with ideas and requests and perhaps prioritize that according to the responses that we get in early February when we have that meeting and discuss them. That way we don't spend too much time in any one meeting focused on this, but at the same time we are continuously moving forward meeting by meeting, doing something constructive on each occasion. And I guess if something new comes up in between or we have a great idea, we can always add it. But this way we have sort of a core group of these items that we can keep building off of. Lindsay, do you still have your hand up for something new or is it just up from before?
No, it's up for something new.
Okay, feel free to go ahead.
So I'm wondering about researching who should be coming to some type of roundtable though, if that should be happening simultaneously, just to keep the work moving forward at a similar pace.
You're wondering what about researching for the roundtable? I'm sorry, I'm not entirely grasping what you're looking for.
Who we would want to invite? So community providers and organizations. Just because I think if the work happens simultaneously, that way it's moving at the same pace, then they can kind of meet at a similar point in time.
Well, I think what we need to figure out is when we're going to do roundtables, if we're going to do them. And I think if we have suggestions, please raise them or send them to myself, Nicole, Jessica, and Carol Ann, and we can try to coordinate and discuss how we're going to fit a roundtable into our conversation. Because as I mentioned before, we have a lot of agenda items and ideas, and I want to make sure that we keep everything somewhat organized and productive and not taking up too much time. And, you know, we're going to have other meetings and things that we all need to go to, particularly if there are more of these homeless shelter meetings that come up. And I think we'll have to take that into consideration, but absolutely, I think it's a good idea. And, you know, if you have ideas that you want to of providers, whether it be Gotham Health or our friends from Brooklyn Plaza, or it doesn't even have to be health related, because remember, we're health, environment, and social services, with, I guess, the unspoken word of sanitation in there too. So, you know, if there, we can only do so much, and hopefully if we think of a good roundtable idea, we can go ahead and do that. But I think what we start with from now is we come to the next meeting with ideas as to what should be our priorities, and in between, if we have ideas for organizations that we would want to invite to a roundtable, fire them away to the folks that I have just referenced. Any other ideas on district needs? Mr. Newmark, this is the last point on district needs.
I feel very honored. I want to really strongly second a point that I apologize, I don't remember who made it earlier. I think we've started in this process jumping 3 steps further than we should. So one of our colleagues suggested public input, and I think that it's kind of shocking that community boards don't seem to have a process to solicit and obtain public input for what unmet needs there are in the district that they would like city government to be more responsive to. And I think that that's really where we should begin, rather than us coming up with what we think those needs are. There's probably a lot of confluence, but there may not be. And, you know, it might be interesting to figure out how to do that. And I know I'm running the risk of being nominated to be part of that group by bringing this up, but I think if we could figure out whom to contact within the district to try to obtain that information, that would be an important first step.
Thanks, Barry. So that was the last point, but for the last point plus one, Ms. Church, perhaps you can also talk about the point about Mr. Newmark's comment on soliciting community involvement in this.
So we actually tried that, and I'm going to go to the back and then I'll come forward. I'll just take a quick look back. Is that I don't know, because I wasn't involved at a board level, if the board did public hearings routinely on the statement of needs. However, last year, we did hold a public hearing. One person, and Mr. Du, showed up. This year, we had hoped to try something else, probably I had hoped to be able to get out a survey. I keep going back to the old story. Staffing made it difficult to do more than regular operational stuff. So we never got around to creating a public survey that we would have sent out with our newsletter. So Barry is quite correct in that we should really be working harder on getting public input in the process. We do have a planning fellow, as was mentioned previously. And one of the parts of her project is trying to create an engagement policy. So hopefully that helps us moving forward. In my head, the ideal time to hold a public hearing would be towards the end of September rather than October, to accommodate the committees that meet early in the month. so that when next you meet, you can incorporate what the public said with the ideas you already have. And so we're on track to get this document in on time at the end of October. So yes, Barry, you hit the nail on the head.
Okay, well, thank you, Ms. Church, and thank you, everybody, for sharing your comments. We're going to take that forward in the next month to ensure that we are planning and taking progressive steps forward in this regard. And thanks for bringing this up, Ms. Church. This has been a good conversation, and I think that it's provided valuable input for everybody on the intricacies of this district needs statement and what we can do to be more effective with our statements in the future. Moving on to the next item on the agenda, we've got a second item of other business related to planning a health fair. Looks like, is Ms. Masso still with us? I think she is. Yes, here we go. And we have other folks on the committee who are on this too. Wanted to put some time aside to talk about this health fair because as a committee, we've engaged in certain projects and over the past year or two, which I think have been good efforts and ideas. And there's a critical difference, though, between those that have achieved some level of success and those which we haven't really gotten off the ground, which is we need to have folks on the committee who are willing to take the lead on planning a project. And we need to identify who are the stakeholders who we would want to engage if we're really talking about what our fundamental function and value is to any community issue, which is bringing people together. So I think what would be really helpful is if for this project, I don't think there's a single person here who doesn't believe that we should have a great health fair that provides health services, health awareness, potentially some testing, potentially some kind of medical treatment to folks in the community. But if we're going to do this, we need to identify where it's going to be. We need to identify who it's going to involve, and we need to identify when it's going to be. And we had some people kind of indicate that they were interested in this. And perhaps if we can just sort of reassess who's interested in sort of taking the lead maybe on planning this. We're not going to have a subcommittee about this, but we can certainly have, a couple of folks take the lead. Is anybody interested in being sort of the leader on that from the committee standpoint? I'm sure Latrell is interested in supporting from her standpoint, but hopefully we can also get somebody else from the committee to work with Latrell. Latrell, do you want to talk a little bit about your vision about this?
Good evening, everyone. Do you hear me?
If you can speak a little bit louder, that would be great.
Hi, everyone. Good evening. Well, what I was thinking was, like over the last year and 2 years that I've been sitting in with you guys on the HESS committee, y'all covered so many interesting topics, and I want to make sure I say the word right, and Alexandra about the birth and I can't pronounce the word, I apologize much, but Alexander, he always talks about it and just like all the different topics from the different programs to support the individual who's incarcerated or when they go to court. We had so many great topics over the past year or two, and we can pull it together in a health fair with the different presenters that came to present, and we could take that and bring it back to the community and show the community what different people we came to present and what we've been talking about. I hope I'm explaining correctly over the time period. And also we have so many different hospitals in our community. We could team up with Brooklyn Hospital, Mount Sinai, we already have a relationship with NYU through the asthma piece. And we could have like a table or area set up for them, the different people. We could also get SUNY School of Optometry to come. I even reached out to them and find out where they come to Brooklyn to talk about eye care and the different areas. So I don't know if I'm making sense, but that's what I was thinking. I mean, am I
Yeah, I think you're making sense, Latrell.
And
Let me
also-
ask you this. Do you have any
also-
idea where in the community you'd want to see this? Like would it be in a particular part of the community, or that might be a good starting point to think of?
Well, I think it should be, so it seemed like we're not coming out of COVID season anytime soon. So I think it should be like in the spring. So it could be like outdoors. So everybody can be outdoor and be comfortable. And also, I mean, like, but also next to a place that, you know, we have to have a piece to go indoors. You know, we can have that piece, but mostly I see it like an outdoor type event with, you know, and also somewhere that everybody could get to, like for public transportation. You know, so people won't have a problem about traveling to get there, so that won't be a concern.
Okay. Ms. Church, I see you've got your hand up.
Forgot to lower it.
It's okay. I don't blame you for that. Anyone have questions or comments on the health fair idea?
I think it's a great idea to have health fairs. I think I would love to offer to help. My only problem is that in the first 6 months of next year, my work is going to be very busy. And so I can't imagine being in that kind of planning position. So I could be sort of backup help if someone needs, but I can't take a co-lead on anything right now. Anyway, but what I was going to say is that I think what could help with this fair and make it different from other fairs, which are often just kind of handing out pamphlets, you know, and a bit of like keychains and magnets for the refrigerator and that sort of thing, is that we ask whoever shows up, whoever we invite, Latrell, tell me if you agree with this, to do some sort of education. So a small micro tutorial on something very targeted that someone can take with them, so to speak. Because my fear is that if you go to a health fair and you're just sort of overwhelmed with all of the different things that exist and every sort of possible illness that one could get and every specialty that one needs to sort of go to, you know, it becomes just a kind of an overload of information. So maybe some way so that it becomes practical, even if we, in the end, produce a document that has that for every provider, here is the kind of the age when you would need this sort of screening, you know, so that it's all on one sheet, something that brings it all together. But then anyway, that's sort of just spitballing.
Thank you, Mr. Varela. I appreciate your thoughts. Ms. Cumberbatch?
I can't hear her.
I'm on mute, folks. Sorry.
Oh, sorry.
So I certainly wholeheartedly agree with Mr. Varela. I envision if it's going to be during the winter months, maybe a settings, if we could get City Hall and have people do presentation, like a very brief presentation on what services they have available, I think would be go a long way in terms of engaging folks. As you said, I've been to health fairs. You get a bag, some freebies, you throw all the materials in your bag and you never look at them again and they, you know, hit the trash can. So I think if we were able to have some presentations that spoke to what services were available, and I think it would be a great idea to have information pamphlets in reference to what services people should be getting and identifying which agencies that are present actually provide those services if we're going to say focus on health screenings, for example.
Okay. Any other thoughts on the health fair idea?
Well, I wanted to say, Latrell, I really like the fact that you came up with this idea because I get the point of ensuring that we are serving the community and also having more of a presence. But because my background also comes from this area of doing health fairs, I know the amount of work that goes into it. And I think your idea of partnering with people would help us in that, in the amount of work that may be involved. I received pamphlets, and usually it's our local politician, they'll join together and do health fairs. So I'm wondering if that could be an opportunity for us to sometimes loan our support and help and contributing to what someone else is already doing. And then something else that came to mind for me was also we can narrow the focus, because what Monique said, to do something educational, if you narrow the focus and you can perhaps do something on mental health, and we can partner with, I forget what they stand for, CEC, Mental Health for Adolescents, and support a forum. That way, maybe we can narrow it down, bring people in, and I'll also tie into, let's also see what the community wants too, because we could do a health fair, but back to where Barry was going, what do people really want or need from us? So those are just ideas I'm throwing out because we're brainstorming.
Okay. Ms. Einhorn?
So I'm wondering if there's overlap between some of the different things we talked about tonight, and that if we want to do community forums, then the research for a health fair can overlap with that because we're looking at local resources. And also, to the previous speaker's point, I think that Lenny is a great resource, and maybe we should kind of just pick his brain a little bit. But with his work at Brooklyn Hospital, maybe they would want to partner with us. And that might be a great place to start. Thank you.
Okay. Ms. McKnight?
But as far as giving you some help on this project, Latrell, I can kind of let you know within another week.
Okay.
Or two.
Thank you.
Maybe we can table that we can keep this conversation going with another spot on the agenda for next month. But Mr. Varela, you had your hand up again.
This might be left field, but just keeping in mind our conversation over the last couple of years and how we look at the various parts to health, including employment and empowerment and all that stuff, I wonder if we could also broaden the scope of the people that we invite, so that it's not just sort of direct service providers, but maybe even the 2 or 3 places we're always recommending where people go to give their resumes. So I can't think off the top of my head because Fort Greene
Snap, Ingersoll Community Center, Brooklyn Navy Yard.
Yeah, so folks, and then I would even go one step further. If we know unemployment is a huge problem and we know what unemployment does to health in a community, if we had a few like sort of apprenticeship places come to talk about how do you get into the pipeline of a sort of a union skilled labor job, that sort of thing. I know it could get sort of it could grow too big, but I'm just trying to think of a way to make this sort of a different take on the health fair that goes more holistic and keeps in line with what we've been talking about for the last couple of years.
Okay, that's a good thought. Ms. Church?
So tying up a few things that a few folks have said, last of all, Alejandro, I sort of like the idea of a focused health fair. I like Alejandro's idea of maybe we can stretch it to employment, but maybe in order for people to make a direct connection, right? Because I come to a health fair and there is someone talking to me about employment and apprenticeship. I don't make the connection. And most people won't. I'm using the universal I. So what we probably need is maybe we need a series of small events and I don't want to put too much on the table, but maybe it's a series of small events, and no one says it has to all happen in 1 year. We can do one every 6 months, and it could be an ongoing thing where we focus in on a topic. And for instance, the relationship between stress and health, and the answer being proper employment in a great working environment, so that people understand the connection, because I think that's also a part of it. So maybe it could be like a health education thing that we do on these public health issues. Just, I don't know if I made sense, but that's my contribution.
Okay, that's a good idea that we can also keep thinking about. Ms. Einhorn, one last thought from you.
I like the idea of going small but many, and then maybe it's just 1 or 2 providers per event, and we partner with the COVID mobile sites and Borough Hall. So it's like a cross promotion event to increase vaccination, because I think that's kind of where we started.
That's a really great point. I think that's definitely something we'll consider. So let's keep that in our conversations in between now and the next meeting, and we'll definitely have an update on that at the next one. I want to move along.
One more.
Okay, if anybody gets the +1, it's you, Carol Ann. So feel free to make your last point here.
But as we're brainstorming, and I didn't want to lose that thought, you know, if we're thinking about the potential to do multiple small events, how about taking the community board to the community? We have parks throughout the community. It'll be a great outreach. And, you know, we'll just go around the district. Just a thought.
What do you mean taking the community board to the community? You mean all of us on the community board, all 60 of us going out to a park on some day?
No. That when we host, whether it's the forum, whether it's a health fair, like whatever it is we come up with. Yeah. And I'm presuming that, you know, Omicron and Delta and its siblings will disappear. Right. That we go to different parts of the district. Even if it's outdoor, we have parks all throughout our district. Right. So we can start off, you know, how much do we think about the eastern edge of our district? Mm-hmm. Really, we don't. We get a liquor license, but so maybe we have an event at Christmas Adults Park. Mm-hmm. You know, so that's what I meant.
That's a good thought. So we will keep that in our minds, and we will definitely discuss it again next month and in between. Want to move along tonight to a topic which I'm sure everyone remembers, which is an update on 275 Park Avenue and the presentation that was given toward the end of October in an informational community meeting. Ms. Church, if you can just give us a little bit of a background on the event, I'll turn it over for Mr. Clark. And I anticipate at most, given that we've already spent nearly an hour at the meeting in June and 45 minutes at the meeting in October on this one liquor license, that we are only going to spend, I'm aiming for a total of 10 minutes on this discussion. So Ms. Church, do you want to start things off with the background of the meeting and how it was announced and to the community?
Well, I would let Mr. Clark go with it because the information that I have was what they stated.
Okay.
But from our end, the community board, we put it out in at least 2 of our Friday newsletters.
Okay. Mr. Clark, are you with us, and are you able to share a brief update on the meeting and how you felt it transpired?
Yes, absolutely. Good night, everyone. So we had another town hall meeting with the residents of the building as well as the community. You guys sent out some emails for us as well. We printed about 500 flyers. We hired a young man who put them in the mailboxes in the surrounding blocks. We had the building send emails to all of the tenants in the building. And we also did hard flyers under the doors of the tenants in the building. Unfortunately, despite all of that, we didn't have that much bigger of a turnout to the town hall than we did in the previous meetings. I think we had a total of 17 or 19, but of those 17, it included 2 members of the community board. It included myself and my 2 partners, as well as we had 2 speakers from the community who we work with, one from the Weeksville Heritage Center, where I do a lot of business, and one from the Lindenwood Diner, where we've been doing shows for the past 17 years. So outside of those 7, it was probably about 12 people, and the majority of them, if I remember correctly, were from the building. This meeting, I think, went pretty good. I think it went a little bit better than some of the others. We had a lot of back and forth dialogue with the people who were there. We also, I had 2 people reach out to me after the fact that I met with personally, had coffee and just sat and talked and you know, discussed different ideas and that type of thing, which was just pretty cool. And I look forward to doing more of that. What else? And you know, we gave out we gave a way for people to reach us if they had any questions. 2 people reached out to us who I met with after the fact, and you know, we're always here to hear and listen to anyone who has any thoughts or concerns or ideas or, you know, things that they want to do with us.
When are you planning to open still?
So right now our target date is April 1st, fingers crossed. We're looking to do the April 1st weekend, which is April 1st is a Friday. So we're looking to do that weekend as our opening date. We submitted to the Department of Buildings to start construction. We're hoping to start construction within the next couple of weeks. And, you know, hopefully the supply chain doesn't slow us down too much or make us have to change design too much, but we're hopeful.
Okay, thank you. Questions from members of the committee? Mr. Varela and Ms. Church, you both have your hands up. I don't know if it's from the prior instance, but you're free to ask a question if you like. Ms. Church? Nope. Okay. Any other members of the committee with a question? Okay. We're not going to have a long drawn out meeting about this, but I always do want to give the folks from the community an opportunity to comment. So Ms. Cassie or Mr. Townsend, do you wish to make a comment?
Hi, yeah, it's Cassie. I do have a quick question for Kwame. Has the building ensured you that the space will be ready for you to begin construction in the next few weeks? Because as of right now, it is still jam-packed, like every inch of it, with the construction supplies for other parts of the building.
Okay.
Yeah, I mean,
before you answer, Mr. Clark, just to let everybody know, a quick reminder for everybody, we are still in the meeting, and the protocol is to address the questions to the chair, but at the same time, I think you, Mr. Clark, understood the question, so you can proceed with the answer.
I'm sorry, I forgot.
No worries, it's okay, Cassie. It's been a couple of months. Mr. Clark?
Yeah, so we're you know, I'm in constant communication with the landlords of the building. So until we have our building permit, you know, we just allow them to use the space, because, you know, otherwise we'll just be sitting empty doing nothing. And if they need the space, we're just kind of working back and forth with them with the space until we're ready to go in there. If they need to use it, you know, we're fine with that. So yeah, but I mean, I speak with them almost on a daily basis.
I know, but I guess my question is, they had originally told you, you had said way back when you were planning to open October. And then I think it was, you know, it was pushed back, and now it's been pushed again. Have they actually told you that all of that will be cleared out so that you can break ground and begin construction in the next couple of weeks?
So what's holding us up isn't the the stuff that they have there, it's we've been having a back and forth about the HVAC system and where it's going to be located. So that's what is really our holdup. And for us, it was kind of, well, we didn't have our building permit yet, so we weren't pushing to get that resolved until we had a building permit, and just kind of working with them as they worked with us.
Okay, thank you. And last question, have you officially been granted the liquor license?
From the State Liquor Authority?
Yes.
They have our application. We haven't gotten it back yet. It takes a few months.
Okay, thank you very much.
Sure.
Thank you, Cassie. Any other questions for Mr. Clark?
I think I see Nicole.
Ms. McKnight, did you have a question?
I just noticed that there was a question from a community member in the chat. And he stated that when he that Laughaholics during the last minute, you did not share an email, but asked folks to message you through the generic contact form on your website, and that you'll respond promptly. He said he did reach out via contact form shortly after the meeting and did not get a reply. He said he'll like to request a direct email address for contact, and he left his email address in the chat. If you scroll through, his name is Tom Monday.
Could you enter that again? Because I don't see it in the,
Well, maybe he didn't leave his email address, but he did ask if you can share a direct email address. So that was the only other comment I saw from the community.
And they said the name was Tom Monday? Because
that's what I think it says, yeah.
Okay.
The office, if I may, sorry. The office will make the connection between you and Mr. Monday.
Sure.
Thank you.
Yeah, I mean, the website goes directly to my personal email. So, I mean, I'll search my email and see if that came in. Maybe it might have went to my spam or something like that, but it comes directly to me personally.
Mr. Townsend has kindly provided this here. It is tom@tommonday.com. If you need to reach him for any reason, he's perhaps one of the easier email addresses to find. Mr. Clark, and Cassie and Mr. Townsend, thank you for coming to so many of our meetings. And I hope it's been a helpful process to get to this point, even if we don't get all the answer that we want. Hopefully we're in a little bit better contact as a result. Thank you all for coming, and I'm going to move along in our agenda to community forum.
Thank you.
All right. Now that we're at community forum, we now have an opportunity for any members of the community who or the board or whomever who want to make a statement. You have 2 minutes, and the floor is yours to do so. Mr. Newmark.
Yeah, I'd like to ask, I guess, Carol Ann, whether or not the community board has thought about asking Governor Hochul to extend the virtual meeting permission that she provided shortly after she joined August. It's supposed to run out January 15th. And I'm concerned that with the potential upsurge in cases that we may see as a result of the Omicron variant, that some of us will be in the same position we were in a few months back, which is not wanting to attend a public meeting, even if we're all sitting there masked. So I just pose that as a question to try to do it sooner than later, if the board is willing to speak with whomever else it speaks with in terms of public groupings in New York State for that to take place.
So 2 parts to that answer. One is that the governor did it to January 15th because that's when the legislature comes back into session. And it's hoped, it's believed that they will pick it up as one of their first items, because the order could not be extended indefinitely, which was why the first one expired. And the governor this is actually a piece of legislation that she signed in order to extend it. So the community boards have begun discussing it. The first order, I don't want to say it came about because of, but it might have contributed that all community boards wrote a letter. I shouldn't say all, but I would say 95% wrote a letter to the governor asking for a return to remote meetings. And currently, the Brooklyn boards are beginning to discuss sending out another letter to ensure that, you know, we get to meet virtually. But we have begun planning for Plan B.
Right. Okay. So that's the answer to that point. And we'll certainly keep our eyes peeled for how things come up when the legislature comes back. Thank you, Barry, for raising it. Thank you, Carol Ann, for responding. Mr. Townsend, I see your hand is up. It is still community forum, so feel free to take the floor.
Awesome. I have a question looking for some advice. There is an illegal nightclub that operates at 16 Waverly Avenue, which is on the opposite side of the building. A tenant in the building and myself have submitted multiple 311 calls about the fact that there's the club operating, and the police respond and say the issue, they don't see the issue, even though when you're out on the street, you can hear the noise. And so, of course, my friend in the building, the bass reverberates throughout it. We have contacted the outgoing council member and her staff. We have contacted the incoming council member. And the NYPD, the 88, told me when I contacted them that they are aware of it, they're monitoring it, but they have a lease. So I didn't realize a lease provided you a get out of jail free card when you're operating an illegal nightclub. So I'm going to start cooking meth in my apartment. So who are the people that we can turn to make sure that this illegal nightclub gets shut down?
Well, it sounds like you're raising the 311 request. You're raising this issue to the police. Ms. Church, has this come up in the board office at all?
First time hearing of it.
Mr.
Okay,
Townsend, do you know the name of the place?
It's 16 Waverly Avenue. It is a down low nightclub that operates maybe after hours club. Sometimes they start at 11 p.m. They're definitely still going on Saturday and Sunday mornings at 7 a.m. I'm more than happy to send you a Google document with all the times that we've filed complaints with 311 and the fact that nothing has happened. If you're aware of something and you're monitoring it, I don't know, it's very frustrating.
Is there evidence that they're serving liquor to people?
On the Instagram advertisements that they make, there's also good evidence of increase in garbage, broken glass, and graffiti out on the street. So I've also contacted the Department of Buildings Inspector General, and that's been the only person that's gotten back to me about the issue. So
okay,
just looking for advice about who we can turn to.
Well, I think if you can send the information to the board office about the particularly any evidence about the Instagram, the link to show anything that's going on at this location.
Sure.
I can't think off the top of my head who we can turn to besides the police. What do the police say in response to this?
Again, I spoke with a funny name, Officer Bobby Crooks at the 88, and he said his comment was that they were aware of it, they're monitoring it, but the people there have a lease. But I've taken pictures of which nobody likes me doing, when I'm out with my dogs in the morning and there's people coming in and out of the venue at 7 o'clock on a Sunday morning. And so that's when I can certainly hear the music. I'm certainly not going to pay $40 to go inside and investigate. But I will do that. I will get some of the screenshots from the Instagram announcements, and I'll forward that along with all the 35 plus 311 complaints.
Okay, thank you, Mr. Townsend. I'm sorry that that's going on, but we'll look into see what if anything we can do about it, and I'll try to look into it too. And you know, we're always here, so we can continue to talk about it in the future too.
Okay,
thank you. Mr. Varela, you had your hand up.
Yeah, just quickly, in the meeting earlier, when we asked the presenter from Cumberland about what were some of the reasons they're hearing for people not wanting to get vaccinated, they said that it all happened too quickly, right? That strikes me as a sort of as a place for a targeted intervention or a tailored intervention. And I wonder what we can do in the short term, whether to notify Department of Health to get more information out there. I've heard this a lot, and there actually is some very valuable common sense responses to that concern around why this vaccine came along faster than other vaccines. And if it's as simple as that, I'm sure it's not as simple as that, but if that would be enough to convince some people, then I think we should do something about it now that we have this information. So that was one thing. And then the other thing, which I guess we can table for another time, is that we had talked over email about, I sent out a video, a sort of an op-doc from the New York Times about the kind of how the NIMBYism ends up pervading the decision-making process in civic bodies like community boards. And I mean, I think we should have that conversation. Maybe it should stick to email, but it is important that we revisit that as we make decisions. I think it's more for the full board than for committees. But yeah, I just didn't want to forget that conversation started.
Right, that's a good point, and I appreciate that you're raising it. I mean, honestly, that was a concern behind getting those standards that we came up with earlier in the year around what liquor licenses we felt would have higher risk. So we'd have something more objective than of which community concern is one aspect of it, but there are other things like private events and outdoor space and super late hours that play into it as well too. Hopefully we can keep going in that spirit and keep up conversations about that. And I appreciate you raising that subject, Alejandro. Any other thoughts before we adjourn tonight? Questions, points from the community?
Just going back to my first point, Brandon, though, sorry, I shouldn't have tied those two together. What is something concrete that we can do to get that information back to DOH or to do something in our district? Because if that is one of the reasons that we are at 58%, you know, in terms of vaccination rates here compared to 70%, you know.
Well, we can include that in our question to them next month, is that what's the standardized response and the best way that we can message to providers like Gotham Health? How do you respond to questions like that? Part of it is also we need to be present to ask the questions of Gotham Health. What is your response when you get those points raised to you? Because for all we know, they're giving great responses and there are just a lot of reticent community members. On the other hand, perhaps they're not giving informed responses, but we don't know unless we ask. And we need to ensure that Department of Health's guidance is getting to our providers locally, and that can be part of our questioning to them. I'll put those questions in along with anything anybody else wants to raise about the Omicron variant, if you get me the questions before the end of this week. And we'll try to have a coordinated effort to approach Department of Health, hopefully for January. And then we can talk with them in person then, or virtually.
Because I'd like to suggest, I mean, that poster, that PSA could already exist. You know, it could be something that is being used in some areas and DOH hasn't, you know, targeted our bus stops or our buildings yet. And if it doesn't exist, then we should put pressure on them to create it.
Okay. Ms. Church?
Just wanted to comment that I already submitted the initial set of questions to DOH, only because, as we know, it can take some time for them to schedule. So the the questions will have to come early on Friday because
Okay.
I'm off.
Gotcha.
So in order to get it submitted and timely.
Okay. Well, we'll get the one in about messaging tonight, and then I'll put in a stock question about Omicron too, so that we can get their points about Omicron. But I don't want this to diverge from the point, which is that the whole point of this presentation is to focus on impact of communities of color. So impact on communities of color. So we can try to keep that in mind too. Any other thoughts for community forum? Hearing none. Do we have a motion to adjourn? I make a motion to adjourn.
So moved.
Second.
All right. Mr. Harrison, I'll give you the second because you're the only one I heard say second. So everybody in favor?
Aye.
Everybody's in favor. Wonderful. Everybody, thanks for being the best committee and the best community. I hope you have a wonderful evening. Happy holidays.
You too.
Take care.
Thanks, Brandon. Thanks, everyone.